Have you ever sat there for 45 minutes, sometimes an hour, feeling that unmistakable pressure, knowing your body wants to go, and yet nothing happens? You strain, you wait, you tell yourself it's just a bad day, and then you get up, defeated, thinking you'll try again after lunch. Except lunch comes and goes, and so does dinner, and the same frustrating cycle repeats itself the next day and the day after that. Maybe you've even started planning your outings around it, avoiding long car rides or family visits because you're never quite sure when, or if, your body will cooperate. If any part of that sounds familiar, I need you to hear this clearly. What you're describing is very likely not ordinary constipation. It's something your body is trying very hard to warn you about, and it deserves real attention, not another trip to the pharmacy for the same laxative that stopped working months ago. I'm Dr. James Revealio, and on this channel, Science of Wellness, we talk about the health realities that most people your age are quietly dealing with but rarely discuss out loud. Today we're going to walk through exactly what's happening inside your body when stool becomes trapped, why this becomes so much more common and so much more serious after 60, and what a safe, sensible path forward actually looks like. If even one part of this feels familiar, drop a yes in the comments below. You'd be surprised how many people are searching for exactly this video right now. What's actually happening in there? Let's set aside the medical jargon for a second and picture something simple, a household drain pipe. For years, water flows through it without a second thought. Then, slowly, almost invisibly, buildup starts to collect along the walls of the pipe. It doesn't happen overnight. It happens gradually, day by day, until one day the pipe is narrow enough that water can barely trickle through, and eventually, it stops moving altogether. That's a reasonably close picture of what specialists call a fecal impaction, a large, hardened mass of stool that becomes lodged in the rectum and is too firm and too large to pass on its own. Here's the part that matters most. Your colon's entire job is really just two things happening at once. It moves waste along, and at the same time, it pulls water out of that waste. Under normal conditions, this is a smooth, balanced system. Stool moves along steadily and stays soft enough to pass without effort. Aging changes that balance in several ways at once. The muscular contractions that push waste forward, known as peristalsis, naturally weaken with age. The nerve signals that coordinate those contractions become less reliable. The sense of thirst becomes duller, which means a lot of people in their 70s and 80s are mildly dehydrated without ever realizing it. And then there are medications. Many of the most commonly prescribed drugs for people our age, including certain blood pressure medications, iron supplements, and pain relievers, list constipation as a known side effect. Put those factors together, and stool moves through the colon more slowly than it should. The longer it sits, the more water gets pulled out of it, and the harder and drier it becomes. After several days without a complete bowel movement, what began as ordinary stool can harden into a solid mass that simply will not pass through the narrow space of the rectum on its own. That pressure you feel, that exhaustion from straining, that quiet worry that something isn't right, all of that is your body telling you the truth. I want to be clear about something, because I hear this misunderstanding constantly in clinic. This is not a reflection of anything you did wrong. It's not poor hygiene. It's not just getting old, and it's not something to feel ashamed of. It's a mechanical and physiological process, and like most mechanical problems, it has an explanation and a solution. If this is new information for you, go ahead and tap that like button. It genuinely helps this video reach more people who need to hear it. Why this is more serious than people assume. Most people hear constipation and think uncomfortable, but harmless. A true fecal impaction is a different situation entirely, and I want to walk you through exactly why. First, there's the matter of pressure on the tissue itself. The rectum can stretch, but it isn't designed to hold a solid, immovable mass for days at a time. When it's forced to stay overstretched, blood flow to the surrounding tissue can become restricted. Tissue that doesn't get adequate circulation can become injured, and in more severe or prolonged cases, that injury can require medical treatment to heal properly. Second, and this one surprises almost everyone I explain it to, your rectum sits directly next to your bladder, separated by only a thin wall of tissue. When the rectum is packed and distended well beyond its normal size, it can physically press against the bladder. The result is often a sudden, confusing difficulty urinating. a constant urge to go, but only managing a few uncomfortable drops, or in more severe cases, being unable to urinate at all. I've had patients come in convinced they'd developed a urinary infection overnight when the actual cause was rectal pressure on the bladder. Once the impaction was addressed, those urinary symptoms cleared up completely. Third, and this is the one I really want you to remember, something called overflow incontinence, which looks almost exactly like diarrhea but is the opposite problem. Here's what happens. The hardened mass blocks the exit, but your intestines are still producing liquid waste further up. That liquid has nowhere else to go, so it seeps around the edges of the blockage and leaks out unpredictably. A lot of people see this and assume, reasonably, well, clearly I don't have a blockage, I have diarrhea. Some even reach for an anti-diarrheal medication to stop it. Please don't do that without talking to your doctor first. Anti-diarrheal medications slow down intestinal movement, and slowing things down is the last thing you want when a mass is already stuck. If you're experiencing what looks like diarrhea alongside days of feeling like you can't fully empty your bowels, that combination is worth a call to your doctor rather than a trip to the pharmacy for the wrong medication. There's a fourth consequence worth mentioning briefly, because it's often overlooked: appetite and mood. A body working overtime to deal with a blockage often produces bloating, nausea, and a general sense of feeling unwell, which can quietly reduce how much someone eats and drinks, which, unfortunately, can make the underlying problem even worse. It becomes a cycle that feeds itself if it isn't interrupted. Save this video now if any of this sounds familiar. You might not need it today, but if it ever happens to you or someone you love, having this information on hand could genuinely make a difference. Why seniors face dramatically higher risk. Fecal impaction isn't distributed evenly across the population. It disproportionately affects adults over 65, and the risk climbs with each passing decade. In long-term care settings, it's recognized as one of the most common gastrointestinal issues clinicians encounter in older patients. The encouraging part is that it's also one of the most preventable conditions once you understand what drives the risk. Reduced mobility plays a bigger role than most people realize. Ordinary movement, walking, light housework, simply standing and moving around, creates gentle mechanical stimulation that helps keep the digestive tract active. When mobility drops because of arthritis, a recent surgery, or a fall, that stimulation disappears, and the colon slows down along with the rest of the body. Even something as small as spending an extra few hours a day sitting instead of standing can measurably slow digestion over time. Dietary shifts matter too. As appetite naturally decreases with age, meals often get smaller, fiber intake drops, and fluid intake drops along with it. Partly because, as we mentioned, the thirst signal itself becomes less reliable. All of this reduces the bulk and moisture stool needs to stay soft. Many of my patients are surprised to learn that a diet built around soft, low-fiber, easy-to-chew foods, the very foods people often switch to as dental issues make chewing harder, can actually be part of the problem, since those foods tend to leave less bulk behind for the colon to work with. Medications are worth a real conversation with your doctor or pharmacist. Opioid pain relievers, certain antidepressants, antihistamines, iron and calcium supplements, and diuretics can all contribute to constipation, and when someone is taking several of these at once, the combined effect adds up. This is especially important if you've recently started a new prescription and noticed your bowel habits changing shortly afterward. That timing is a meaningful clue, and it's worth mentioning to whoever prescribed it. And finally, there's suppression. Many people in this generation grew up in an era when talking about bathroom habits simply wasn't done, and that habit of "I'll go later" often persisted for a lifetime. Repeatedly ignoring the urge to go can gradually make the rectum less sensitive to that signal over time, which means the urge becomes weaker and less frequent, and waste sits longer than it should. Over years, this can genuinely retrain the body's signaling system, which is part of why some people describe simply not feeling the urge anymore, even when they clearly need to go. Knowing your own risk factors is the first real step toward keeping this from happening again. What to do if you're dealing with this right now. If you're in the middle of this situation today, here's how to approach it sensibly and safely. Stop straining. I know the instinct is to push harder, but a hardened, Dehydrated mass doesn't respond to added pressure the way normal stool does. It's simply too firm. Continued straining raises your risk of hemorrhoids, anal fissures, and in some cases, a sudden drop in blood pressure that can cause fainting. If you have any heart or blood pressure condition, aggressive straining can put unnecessary strain on your cardiovascular system too. Stop, breathe, and take this step by step. Start with an over-the-counter glycerin suppository, available at any pharmacy without a prescription. Lie on your left side rather than your back. This position works with the natural curve of your colon to help direct the medication where it's needed. Use a generous amount of water-based lubricant, since the surrounding tissue is likely already irritated. After insertion, stay still on your side for a full 30 to 45 minutes. Glycerin works by slowly drawing moisture into the stool and softening the outer layer, and it needs that time to work. Getting up too soon typically means passing only the suppository itself, with the impaction still in place. If a single over-the-counter suppository doesn't fully resolve things, don't assume you've done something wrong. For an established impaction, it's common for this to take more than one attempt, and it's worth calling your doctor or an on-call nurse line to ask about appropriate next steps for your specific situation before repeating or increasing anything, since the right approach can depend on your medications and other health conditions. If there's still no real progress, gentle movement can help between attempts. A slow 15 to 20 minute walk around the house stimulates the natural muscle contractions of the colon. Afterward, a warm water or saline enema, sold over the counter in most pharmacies, is generally the next reasonable step. Again, follow the package instructions carefully, lie on your left side, and don't rush. If home measures haven't worked after a genuinely thorough attempt, it's time to go to urgent care or the emergency room. This isn't a failure, it's the correct medical decision. Hospitals have access to stronger therapeutic enemas, imaging to assess exactly how far the impaction extends, and if needed, a procedure called manual disimpaction, where a clinician carefully and gently clears the blockage by hand, almost always with sedation or local numbing so it isn't painful. It's an uncomfortable thing to describe, but it's a safe, routine procedure, and patients consistently report enormous relief afterward. I want to give you a short list of true emergency signs, because these override everything else we've discussed. If you experience severe or worsening abdominal pain, vomiting, fever, chills, rectal bleeding beyond light spotting, or a general sense that something is seriously wrong, don't wait through the home steps. Go straight to urgent care or the emergency room. Those symptoms can point to complications that need prompt evaluation, and there's no home remedy that substitutes for that. Recovery. Once the impaction has cleared, whether at home or with medical help, give your body a few days to recover. The rectal tissue will likely be tender and slightly swollen for 24 to 48 hours, and some mild spotting or discomfort during this window is normal. A warm sitz bath. Sitting in a few inches of warm water for 10 to 15 minutes, a couple of times a day, can be genuinely soothing and supports healing. For the first few days afterward, favor soft, easily digestible, fiber-containing foods, oatmeal, cooked vegetables, ripe bananas, and soups with soft vegetables. Steer clear of dry, low-moisture foods, and make a real effort to drink water steadily throughout the day, even before you feel thirsty. This is also a good moment to schedule a visit with your primary care doctor to review your medication list for anything contributing to constipation. If this has been a recurring issue, ask about a referral to a specialist who can properly evaluate how your digestive system is functioning. And if you're due for a colonoscopy, this is a good time to make sure nothing structural is contributing to the problem. It's also worth keeping a simple written log for a couple of weeks afterward, noting what you ate, how much water you drank, and your bathroom habits. That small habit gives your doctor real information to work with instead of guesswork, and it often reveals patterns you wouldn't have noticed otherwise. Building a life where this doesn't happen. Again, everything we've covered so far has been about handling a crisis. What matters more is preventing the crisis from happening in the first place, and that comes down to 4 consistent habits. Hydration comes first. Water is the single most effective tool your colon has for keeping stool soft. Aim for 6 to 8 glasses a day. Herbal tea, broths, and water-rich fruits and vegetables all count toward that total if plain water is difficult. A simple trick many of my patients find helpful is keeping a filled water bottle within eyesight throughout the day. You're far more likely to drink consistently when it's right in front of you, rather than something you have to remember. Movement comes second. You don't need intense exercise. A daily 20 to 30-minute walk does real, measurable work for digestive health. If walking is difficult, gentle chair exercises or swimming can still help keep things moving. Even breaking that walk into two shorter 10 to 15-minute sessions, one in the morning and one in the evening, can be just as effective and easier to fit into your day. Dietary consistency is third. Soluble fiber from oats, fruits, legumes, and cooked vegetables adds bulk and retains moisture in stool. Introduce it gradually if your diet has been low in fiber to avoid bloating, and try to eat meals around the same time each day so your body can settle into a rhythm. A simple, sustainable goal is to add just one extra fiber-rich food to your plate each day, rather than overhauling your entire diet at once. A consistent bathroom routine is the fourth pillar, and it's the one people skip most often. Your colon is naturally most active shortly after breakfast. That's your body's built-in signal working in your favor. Sit on the toilet during that window every morning, even without an urgent need to go, and consider using a small footstool to slightly elevate your feet, which puts your body in a more effective position for elimination. Give yourself several unhurried minutes without straining. Over time, this consistency retrains your body's natural rhythm. One last thing worth saying plainly: try not to lean on stimulant laxatives as an everyday, long-term solution. They're effective in the short term, but regular long-term use can make the colon dependent on that stimulation, so that it struggles to function on its own once you stop. If constipation is a recurring pattern for you, ask your doctor about gentler, sustainable options like fiber supplements or osmotic agents that are designed for long-term use. I know this wasn't the easiest topic to sit through, but understanding what's happening in your own body and knowing there's a clear, sensible plan if something goes wrong matters more than any momentary discomfort of talking about it. And you don't have to handle it alone or feel embarrassed about it. This is one of the most common issues I see in patients over 60, far more common than people assume from how rarely it's talked about. If this video was useful to you, share it with someone in your life who might be dealing with this quietly and not saying a word. Like the video if it helped, and subscribe to Science of Wellness so you don't miss what's coming next on digestive health and healthy aging. Take care of yourself, drink your water, keep moving, and I'll see you in the next one.